If you've been told that you have an autoimmune condition that is affecting your thyroid, then today's show is dedicated to you. If you've been struggling to navigate health challenges such as Hashimoto's, hyperthyroidism, or Graves' disease, then stick around. We are going to discuss natural solutions to support thyroid-related autoimmune issues and help you understand how you can take back control over your thyroid health. Welcome to C60 Health Connections, where we meet with leading experts in the health and wellness space. Dr. Eric Osansky is with us today. Dr. Eric is a chiropractor, clinical nutritionist, and certified functional medicine practitioner who helps people recover from thyroid and autoimmune thyroid conditions. He is the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves' disease, and also the book Hashimoto's Triggers. Dr. Osansky was personally diagnosed in 2008 with Graves' disease, and after taking a natural treatment approach, he's been in remission since 2009. After seeing how well natural treatment methods helped with his condition, he began using these natural thyroid treatment protocols to help others with different types of thyroid and autoimmune conditions, including hyperthyroidism and Graves' disease, and hypothyroidism and Hashimoto's thyroiditis. My name is Jessica McNaughton, and I am the CEO at shopc60.com and at c60purplepower.com. I'm a business executive with years of experience in corporate America, and for more than 20 years, I've been exploring various modalities in health, wellness, and spirituality. Now, before we get started, any statements, products, or remedies discussed today have not been evaluated by the Food and Drug Administration. Any products or topics or protocols discussed today are not intended to diagnose, treat, cure, prevent, or mitigate any disease. And with that, we'll get started. Eric, so great to see you today. Thank you so much for joining us.
Yeah, great to be here, Jessica. Thank you so much for having me. I appreciate this opportunity.
Oh yeah, you've got such a interesting background, and I am really excited to sit down and talk with you today to learn more about these natural solutions that are available to all of us for these thyroid-related autoimmune conditions. So I want to first just start a little bit with your backstory and understand a little bit about your journey. As I understand, you were diagnosed with Graves' disease not too long ago.
Yeah, so in 2008, I was experiencing symptoms. Actually, you know what? I wasn't experiencing, I was dieting, I was detoxifying, and everything was going great initially. It was feeling pretty good. I was losing weight and didn't suspect anything was wrong. But then I realized that, first of all, I was losing a good amount of weight, but I did attribute that to the dieting and detoxification. But then one day I was walking in a Sam's Club, and they have one of those automated blood pressure machines. And so I sat down, took my blood pressure. My blood pressure was fine, but my resting heart rate was elevated. And so the next few days, I multiple times per day would manually check my heart rate, and it was consistently in the 90s, sometimes triple digits. And so that I knew that wasn't right. And then I started putting the pieces of the puzzle together with the weight loss, which is common with hyperthyroidism. Not everybody experiences it, but one of the more classic symptoms. And just then I started noticing some palpitations and scheduled an appointment with a primary care physician. And sure enough, diagnosed me with hyperthyroidism and referred me to an endocrinologist. And then the endocrinologist did some additional testing, specifically the antibodies for Graves, and confirmed that I had Graves' disease. And most people with Graves, we could talk more about the treatments, conventional and natural, but I held off on taking the medication, which is anti-thyroid medication, methimazole, and started on my natural healing journey. And been in remission, as you mentioned, since 2009. And since then, I've been working with people with both hyperthyroidism, Graves' disease, hypothyroidism, and Hashimoto's.
Okay, well, let's start with kind of like the definition of these different diseases. Can you just walk us through what's Graves' disease and how does it differ from Hashimoto's thyroiditis? Thyroiditis. It sounds like I've got marbles coming out of my mouth. Thyroiditis.
Yeah. So Graves is an autoimmune hyperthyroid condition. So hyperthyroidism, not all cases of hyperthyroidism are autoimmune, but most of them are. And so that's called Graves' disease. So how it presents symptom-wise, some of the classic symptoms, again, that increased resting heart rate I mentioned, heart palpitations. A lot of people experience weight loss, loose stools, insomnia. Again, not everybody experiences all these symptoms, but some people also have what's called thyroid eye disease, which causes bulging of the eyes, pressure in the eyes, sometimes double vision. And with hyperthyroidism, you get most of the same symptoms except the thyroid eye disease. That's also related to the autoimmune component. And as far as differentiating just a non-autoimmune hyperthyroidism from Graves' disease, the main way is through testing for antibodies. And with Graves' disease, it's specifically the thyroid stimulating immunoglobulins, or TSI, which is a type of TSH receptor antibody. And when it comes to Hashimoto's, so that's that's an autoimmune, more towards the hypo side. Again, not everybody is clearly hypo, and I think that was your story. We're chatting a little bit where your labs weren't they weren't within the lab range, but not the optimal range. And so with Hashimoto's, you'll typically, how it's diagnosed is you'll have an elevated TSH, which is thyroid stimulating hormone, and then you'll also have one or more thyroid antibodies, typically thyroid peroxidase antibodies, which are also commonly elevated in Graves, but more closely associated with Hashimoto's. And then there's what's called anti-thyroid globulin antibodies. And some of the common symptoms of Hashimoto's include fatigue, brain fog, weight gain, constipation, coldness. So if someone's experienced overall coldness, or a lot of times cold hands and feet. And I mean, those are, again, with both Graves and Hashimoto's, it could be, many more symptoms, some more typical, some not as common. And with the thyroid panel, I mentioned the antibodies and the TSH, which is more of a pituitary hormone, but then there's the free T3, free T4, and many times they're within range, but less than optimal. And then sometimes they're overtly depressed, well out of the reference range. So, and yeah, those are really the main differences between these two conditions.
Between those two conditions, which ones might you experience hair loss with?
Actually, with both. I mean, I didn't mention that when I was going over the symptoms of hyperthyroidism, but a lot of my patients experience hair loss with that. But really, any thyroid hormone imbalance, so you do see that also with Hashimoto's as well. So either one of those conditions can result in the hair loss. Okay.
So what was it with your process that you figured out, or like what was it about the process that you went through that you decided, hey, I don't want to go down this medical route. I want to seek out some natural solutions. Can you just tell us a little bit about kind of what you were thinking and feeling during that time?
Sure. Well, my background's a chiropractor, and whenever I was attending back then a conference for my CE credits, continuing education credits, I would always gravitate towards the conferences, the seminars that discuss nutrition and natural healing, which is what chiropractic's about. And there were a couple of courses on functional endocrinology, like natural endocrinology. So when I was diagnosed with hyperthyroidism, I knew there were, now I personally didn't know anybody who went through those natural treatments, but I knew that there were potential options. And so at that point, I made a decision, I'm going to at least attempt the natural treatment. And that's why when I saw the endocrinologist, I already was convinced that I was going to not take the medication. And I'm not against medication. Actually, a lot of my patients do take the medication because sometimes you have no choice. It could be serious if you don't manage it safely. But I figured I'd give the natural approach a try, which from a symptom management standpoint, I took herbs. Bugleweed is the main herb that has anti-thyroid properties. And then there's another one I took called motherwort. So I knew once I got that diagnosis, I was at least going to try taking the herbs. and I figured I'd give it a month or two. And if I didn't see any results, then I would have taken the meds. But fortunately, things went in the right direction symptom-wise, and eventually blood test. And I didn't have to take the medication, or other treatments like radioactive iodine, thyroid surgery are also commonly recommended for Graves. But yeah, so I had that mindset pretty much right when I was diagnosed with hyperthyroidism.
Okay. Thank you. What causes thyroid autoimmunity? Can you talk to us about some of whether they're food triggers or environmental triggers? What might set this off in an individual?
Sure. Well, there's what's called the triad of autoimmunity. And so according to that triad, 3 factors that are necessary for autoimmunity to develop. So one is a genetic predisposition. And fortunately, that's not the most important component, but that is a factor. And that's why I usually say that we can't permanently cure these conditions. I do say use terms like restoring your health, but as far as permanently cure, you will always have that genetic predisposition. But again, the other 2 components are more important. And so component number 2 is exposure to one or more environmental triggers. And as far as different triggers, so I talk about 4 categories of triggers, such as food is one, gluten, dairy, corn, and salt. Actually, salt increases what's called Th17 cytokines, which play a role in autoimmunity. So you don't want to overdo it with the salt. And then stress. Stress is another trigger. Stress is, of course, very common, and a problem in this day and age is, we're never going to get rid of the stressors, but people aren't doing enough to improve their stress handling skills. So that's another trigger. A third trigger: environmental toxins, environmental chemicals, heavy metals such as mercury, xenoestrogens such as BPA, bisphenol A, and there's so many different triggers, and we don't know the effects of all of them. But then it's impossible to eliminate all the toxins, but we could do things to reduce our toxic load. And then a fourth one is infections. There's viruses such as Epstein-Barr virus, there's cytomegalovirus, and there's gut infections such as H. pylori, and parasites such as Blastocystis hominis. There's a case report showing a correlation between Hashimoto's and one called Yersinia enterocoletica, which could be a potential trigger for Graves or Hashimoto's. And yeah, so those are the main triggers. And then there's other imbalances like nutrient deficiencies. I don't really consider a trigger, but if you have deficient selenium levels, that could definitely predispose you to an autoimmune condition that make you more susceptible. And then the third part of the triad of autoimmunity is an increase in intestinal permeability, which is also known as a leaky gut. And different factors can cause a leaky gut, such as, again, we mentioned gluten earlier, that could cause a leaky gut, certain gut infections, glyphosate, which is an herbicide. It's the active ingredient it's a part of the herbicide Roundup. And so that could disrupt the gut microbiome. And of course, other medications like antibiotics and proton pump inhibitors. So those are essentially the different types of triggers that could affect and cause Graves or Hashimoto's. Sometimes it might not directly cause, but might just be a contributing factor. But either way, those are things that you want to look into. It doesn't mean you have to test for all of them necessarily right off the bat, but you definitely want to be aware of at least initially the food triggers and make dietary changes. Try to do things to improve your stress handling skills. And then depending on the person's presentation, they may or may not want to do like more testing for like a stool test for infections or other types of testing.
Okay. Is there a particular diet that you'd recommend for people like right out of the gate to start if they're concerned about their thyroid health as part of like one of these natural solutions or remedies?
Well, there's no diet that fits everyone perfectly, and it does to some extent depend on the person. I will say in most cases for Graves and Hashimoto's, I do recommend as a starting point what's called the autoimmune paleo diet or AIP diet. But it depends. If someone's a vegan, vegetarian, that's an extremely difficult diet to follow. I mean, it's challenging regardless, but so we might make modifications. And if someone is eating fast food on a regular basis, just not eating a great diet, it might be more difficult to make that transition. So we might just have them start off with a paleo diet or a modified paleo diet. So that's for the majority of people, that's a starting point, the AIP diet. And then eventually we have them reintroduce foods. And so it's definitely not a permanent diet.
And so with that particular diet, is it safe to assume that you're going to remove gluten and your exposure to glyphosate?
Yeah. So, I mean, gluten, definitely, dairy, definitely, I mean, pretty much grain free. And then it differs from paleo in that you're eliminating eggs, you're eliminating nuts, you're eliminating nightshades, and again, that's what makes it really challenging. And the reason these foods are removed, at least some of them, like some people wonder about the eggs, and legumes are also removed, and nuts, and it's because the compounds, lectins, and other compounds in some of these foods that could affect gut healing, which is a big factor when it comes to autoimmune condition, or different autoimmune conditions. As far as glyphosate, I mean, it's really difficult to eliminate completely, but obviously you could do a lot by eating certified organic and, just trying to eat whole healthy foods. Because again, anything prepackaged, is more likely to have glyphosate. Again, if it's certified organic, probably not, or at least a very low amount. Again, sometimes even with organic food, there's, some sources say that there's still some, minimal amounts of glyphosate in there. But if someone can eat mostly organic, sometimes it's a problem because they either can't afford 100% organic diet, so they might just have to focus on, like just on vegetables, eating organic, produce, and maybe organic meat if they eat meat. And so yeah, it's just really about trying your best.
Okay. Can you tell us a little bit about other non-autoimmune types of hyperthyroidism?
Yes. So probably next to Graves', the most common non-autoimmune hyperthyroid condition would be what's called toxic multinodular goiter. And with this is when you have a goiter, which is a swelling of the thyroid gland in the presence of one or more nodules, which think of it as like little growths of thyroid tissue. And so with that, a lot of people have multinodular goiter that isn't hyperthyroid. But when you have the toxic component, when you have hyperthyroidism in the presence of the goiter and the nodules, that's when it's called toxic multinodular goiter. And another common non-autoimmune hyperthyroid condition is thyroiditis, like subacute thyroiditis. And with that, it's usually viral induced. Virus usually causes that. And that usually is more temporary. Whereas Graves', could last for a long time. Toxic multinodular goiter, if you're not addressing the cause, could last quite a while. Subacute thyroiditis usually lasts anywhere from 1 to 2 months to, maybe 4 months, sometimes longer. But, kind of, you could say it kind of self-resolves, even though I've seen people relapse because the virus is still a factor. So even with that, you probably want to do things to improve the immune system, healthy immune system. And then the one other I'll mention is hashitoxicosis, which is essentially Hashimoto's presenting as hyperthyroidism. And in this case, you're getting a lot of damage to that thyroid gland, and it's releasing the thyroid hormone into the bloodstream. So the person may feel like they're hyperthyroid. Sometimes will get misdiagnosed as Graves' because the doctor doesn't test the Graves' disease antibodies. They just test the antibodies associated with Hashimoto's. And the thing is, those could be positive. Like I've seen people have all 3 antibodies. So you still in that. So again, it could get a little bit tricky, but those are the 3 different non-autoimmune, the more common non-autoimmune hyperthyroid conditions.
What are the potential risks that people could be dealing with if any of these thyroid related, whether it's autoimmune or not autoimmune conditions, are allowed to, run undiagnosed? What could possibly happen?
Well, the big risk from an autoimmune standpoint is that the research clearly shows that if you have one autoimmune condition, you're at greater risk of developing other autoimmune conditions. So if you, for example, if you go to an endocrinologist or another type of medical doctor, if you have Hashimoto's, many times they'll give levothyroxine or sometimes a different type of thyroid hormone replacement. And then with Graves' disease, they'll commonly give anti-thyroid medication such as methimazole or PTU, or sometimes radioactive iodine thyroid surgery. But none of these are addressing the cause of the immune system. So when someone has Hashimoto's, for example, and they're on thyroid hormone replacement, it might be important for them to take that. But if they don't do it, if the endocrinologist doesn't recommend anything else, which usually is the case, then that person's the autoimmunity is still going to be present. And like I said, you can't necessarily cure that, but you could put it in remission. And so the person's autoimmune response, isn't active. I could say, just like you're really addressing that autoimmune component. Ideally, want to address it, and this way you're not getting the same amount of damage to the thyroid gland too. So that's a risk too by not addressing it. But again, a big factor is just by removing triggers, healing the gut, you're minimizing the risk of developing other autoimmune conditions if you have either Graves or Hashimoto's, or really with any autoimmune condition. If someone has multiple sclerosis and you're not addressing that autoimmune component, same thing. You're still, not only will the condition progress over time, but also the person very well might develop other autoimmune conditions.
Okay. Thank you. What, can you talk to us about some of the different treatments for hyperthyroidism and Hashimoto's, like both like conventional and natural options that people could explore?
Yes. So with hyperthyroidism, again, initially you want to manage the symptoms. So it's important to either, again, I explained in my situation that I took bugleweed and motherwort, and there are other natural options for symptom management, like taking L-carnitine in higher doses can also sometimes be effective depending on the person. There's lemon balm, which is an herb with a calming effect and maybe some mild anti-thyroid properties. But again, some people do need to take the medication, and especially if the herbs don't work. And if someone's taking the medication and they're not having side effects, which are common, unfortunately, with the anti-thyroid medication, then again, I never tell anybody to stop taking it, or and there's risks of stopping it because again they might switch to the bugleweed, for example, and it might not work. And some people do that anyway, and then some people do fine, some people have to go back to the medication. But the other treatments, there's really 3 treatments for hyperthyroidism from a conventional medical standpoint. So the one is I mentioned already is the anti-thyroid medication, and sometimes I throw into the same category beta blockers. But then the second one is thyroid surgery. So some doctors will recommend to remove the thyroid. And then a third common treatment is radioactive iodine, where they're ablating the thyroid. And as I mentioned earlier, just none of these are addressing the cause of the problem. And even bugleweed, the herbs that for symptom management, are not addressing the cause of the problem. And so when addressing the cause of the problem, you want to find out the source of the problem. And some of it, like diet, of course, everybody could change their diet, and stress, everybody can manage their stress. But I do recommend some testing, like for stress and adrenals. I usually recommend either adrenal saliva testing or what's called dried urine testing. There's one called the Dutch test. And these both look at what's called the circadian rhythm of cortisol levels throughout the day, whereas blood testing only looks at a single sample. And so, tests like these can help to determine the state of the adrenals. And, some people might need to do a comprehensive stool panel to see if they have a gut infection like H. pylori. And when I'm talking about this latter part, actually applies to both Graves and Hashimoto's from the natural standpoint. So like adrenal testing, sometimes testing for the gut, sometimes doing other types of testing, blood testing included, to see if your vitamin D levels are low, which could also, make you more susceptible to developing autoimmunity. And so anyway, there's a lot of different tests, and I discussed these in my books as well that you mentioned. As far as conventional treatment for Hashimoto's, as far as symptom management, because that's really all they do is the symptom management, and that again is usually synthetic thyroid hormone, levothyroxine, most commonly Synthroid, although there's more hypoallergenic types such as tyrosines. Some will take what's called desiccated thyroid, which usually porcine derived from a pig. There is bovine sources out there, but prescription-wise, it's usually porcine, things like Armor, Nature Throid, WP Thyroid, NP Thyroid. And again, it could be important to take this, maybe temporarily, sometimes long-term, but since it's not doing anything for the autoimmune component, you want to address the cause. But I also will mention, some people will ask, can I take something to manage the symptoms other than thyroid hormone? And there's no herbal replacement for thyroid hormone. So, I mean, there are herbs, like, for example, ashwagandha is one that can help stimulate, in some cases, production of thyroid hormone. But if someone has Hashimoto's, it's probably not really going to be the answer. So again, that's again, if you have lower thyroid hormone levels, especially if they're overtly low, below the optimal reference range, and you probably have to take thyroid hormone. And one other thing I'll mention is, it's not really conventional, but it is a prescription, but it's something called LDN, low dose naltrexone, and so that modulates the immune system. I find it when it works. Again, I don't recommend it to everyone, but when it works, it could work wonderful, and sometimes does work wonderful. But I find it to be more hit and miss. A good amount of people will take it and really not notice a difference. But since these are autoimmune conditions, when it works, it calms down the immune system. But at least in Graves' hyperthyroidism, Graves' disease, it's not used as a primary treatment just because it is hit or miss. And if someone has a really high resting heart rate, and the elevated thyroid hormone levels could affect bone density, you want to do everything you can to be safe quickly. But some people do both. They'll be on the antithyroid medication. They might also take the LDN. But those are some of the different types of treatment, both conventional and natural.
Are there any particular risks with conventional treatments that people should be aware of?
Well, with hyperthyroidism, I mean, the antithyroid medication does cause very commonly, not with everybody, but very commonly causes side effects. And sometimes the side effects could be, I won't say severe as far as life-threatening or anything like that, but like the antithyroid medication many times will elevate the liver enzymes, could depress the white blood cell count, and usually the doctor will know this because they'll do a CBC, complete blood count with differential, and a comprehensive metabolic panel to look at the liver enzymes. And so, and the person, the blood test might look fine, but they might have other symptoms like skin rashes or, just dizziness. So again, if any of this takes place, maybe not the rashes, but if they have severe symptoms or, again, elevated liver enzymes, depressed white blood cell count, then the doctor may take them off the medication, or sometimes switch them from methimazole to PTU, or vice versa. Most people start with methimazole who are taking that. And then, thyroid surgery, of course, there's always risks when any type of surgery. And so there's that risk. And then also, if they get a complete thyroidectomy, then they're hypothyroid. They become hypothyroid. So then they have to, regulate the thyroid hormone. That, I wouldn't say that's necessarily a risk, just sometimes a major inconvenience, and the person may still feel bad. And then radioactive iodine, again, there is some risk with that. If there's some risk with Graves of it, people getting that and then developing thyroid eye disease, or if they already have thyroid eye disease, making the thyroid eye disease worse. And with Hashimoto's, I don't really think there's a major risk to taking thyroid hormone, other than, as I mentioned earlier, it's just not addressing the cause. So if that's all the doctor's doing, which is very common, then that autoimmune component can progress, and then you're getting more damage to the thyroid, and again, greater risk of developing other autoimmune conditions. And that's also a risk with Graves, with, again, as I mentioned earlier, with taking antithyroid medication, surgery, radioactive iodine, same thing.
Okay. Can you give us a little bit of coaching if somebody has just gotten information from their healthcare practitioner that they've got a thyroid issue? What types of questions should they be asking in order to really vet and make sure that the the practitioner that they're working with is really qualified as an expert in this area to make sure, number one, that they're getting the right tests and that they're going to get the appropriate recommendations for treatment, whether those are natural or conventional.
Yeah. So with, I guess, especially like what a lot of medical doctors, including endocrinologists, are more familiar with Hashimoto's because it's a lot more common than hyperthyroidism, Graves' disease. So with that, they usually won't want to hear the answers to this question. But one question is, like if they are given thyroid hormone replacements, what is anything, since it's autoimmune, are they going to do anything for the autoimmune component? And usually the answer is no. And that just comes down to their training. You could also ask them if you prefer a like desiccated thyroid, because again, most of them will recommend synthetic thyroid hormone. And it depends on the doctor. Some doctors will be open to that. Others will not be open to that and will just say, no, this is what I recommend. And so, you could, again, ask like questions about diet. Are there any recommendations for diet? But typically conventional medical doctors, they don't make any connection between diet and developing autoimmunity or really anything I discussed, the infections, actually, that's not completely true. The infections, they know, I think, that certain viruses, including one that we're currently dealing with these days,
right?
In the literature, there clearly is a correlation between, more so I've seen hyperthyroidism, and again, but there is some connection between hypothyroidism. So, I mean, honestly, there's not a lot of answers you're going to get from most medical doctors, but you could ask if it's a medical doctor with an open mind, or conventional medical doctor conventional medical doctor with an open mind, or a medical doctor who practices functional medicine, they'll be more open. Blood testings, is one thing too. Like, a lot of times they'll just do a thyroid panel, and you want to make sure they do the antibodies for both Graves and Hashimoto's, because a lot of times they'll just do the thyroid. And again, more so for Hashimoto's, a lot of times we'll see them just test TSH and hopefully the thyroid hormones, free T3, free T4. But again, some of them don't test the antibodies. Graves, they usually do, to rule out different types of, whether it's autoimmune or not. But still, if they don't do it in the case of Graves, then you do, if it's hyperthyroid, even if they're suspecting like toxic multinodular goiter, which is usually non-autoimmune, but there's cases where sometimes people will have multiple conditions. And, what Graves, I guess, is just what's the long-term plan, or, hyperthyroidism in general, because a lot of times their plan, if they do recommend antithyroid medication as a first step, then they might say, well, you're going to take it for a year and a half, 2 years, and we're going to hope that you get into remission, which usually is temporary because you're not addressing the cause. But if things don't get into remission, then usually the next step is radioactive iodine or thyroid surgery. And that's assuming the person doesn't receive that initially, because sometimes that they jump right to that treatment. So, if that's their game plan, I mean, a lot of people will be fine with that, especially those who are not looking for a natural treatment option, it's just, again, as far as lifestyle, dietary changes, they again usually don't relate that at all to hyperthyroidism. And then testing, just trying to do more, not only just thyroid in the case of both Hashimoto's and Graves, but you want to do the basics. A lot of times they'll do CBC with differential, complete blood, comprehensive metabolic panel, a lipid panel, but then you want to go beyond that. And sometimes they're resistant to do that, like vitamin D. I mentioned earlier that that's important to have healthy levels of vitamin D, things like an iron panel, looking at C-reactive protein, which is an inflammatory marker. And again, there's other blood tests, but most endocrinologists will just stick with the basics. And then if you want the other blood test, you're either going to have to order it on your own or work with a functional medicine practitioner to get those tests. But those are some of the things you'd want to bring up to your endocrinologist or regular medical doctor.
Okay. And do you find that, most are willing to work in conjunction with a functional medicine practitioner, or would you just need to make a shift at that point if you wanted to explore more of this deeper testing to really get at like what the root cause is of the autoimmune condition?
Yeah, so they once again, they don't usually do any of the testing I mentioned, like saliva testing, stool testing or other type of blood tests. Like if you want testing for Epstein-Barr or other viruses, they usually won't look at that. And so, some of them are open to, like, if you're working with a natural healthcare practitioner, functional medicine practitioner, they may or may not be open to that. So with Hashimoto's, probably more likely, because honestly, the person usually is not going to go frequently to, the endocrinologist, maybe more in the beginning to adjust the thyroid hormone, but still they probably don't really care in that case if someone is working with a natural, I shouldn't say that. In some cases, I'm sure they do care, but again, most of the time it's not as big of a deal. But with hyperthyroidism, Graves' disease, a lot of times they're resistant. And especially if someone tells them, if a person is working with an endocrinologist and they don't want to take the methimazole, the anti-thyroid medication, and they say they want to take the bugoe. A lot of times the endocrinologist will, first of all, they won't be familiar many times with that, but whether or not they're familiar, they'll usually say no, and if sometimes they'll threaten to dismiss the patients if they're not following their recommendations. So I find that in most cases, they're just not open, very closed-minded. And I think a big reason for that when it comes to hyperthyroidism is because Hashimoto's is, don't get me wrong, if you have real low thyroid hormone levels, that's not good and cause complications. But hyperthyroidism, you could get into a lot of trouble if it's not managed. You could get, atrial fibrillation. There's what's called thyroid storm, which is a medical emergency. And, I can't say these are common, especially like thyroid storm, but, their concern is, if someone's not following their recommendations, if they're straying from the recommendations, that they might be at an increased risk of getting a thyroid storm or, getting arrhythmias or, AFib. So yeah, I think with Hashimoto's, they're more open to that, just because it's not really going to affect anything as far as the thyroid hormone. And so with hyperthyroidism, I find it works well. It works fine together if someone's taking anti-thyroid medication, but they're just not too familiar with that. And again, they're concerned if someone's not taking anti-thyroid medication, just taking the herbs, that again, they might run into trouble.
Okay. So do you have any resources that you might be willing to share with our audience around how they might be able to maybe check the level of triggers that are in their environment or maybe that they're being exposed to?
Yeah, so a few resources. So the books you mentioned earlier, the Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. And again, one of the books, as you mentioned, Hashimoto's Triggers. So that's pretty comprehensive when it comes to triggers. And, my YouTube channel, Natural Thyroid Doctor. And then also I have a thyroid checklist, and the website, pretty easy to remember, thyroidchecklist.com. And that's where you get a checklist of a few pages, goes over some of the different types of triggers. Again, there's definitely more detail in my books, but again, this is completely free, and just a good starting point to find out about the different triggers and what you can do to remove the triggers. So yeah, I would recommend that. And again, they could visit thyroidchecklist.com.
Okay, great. And then if people want to get in touch with you, what's the best way that they can connect with you? Once they've gotten the book or the books and they've done the test, how do they connect with you?
I guess the best way, there is you could there's a website, workwithdreric.com. So that is a website that you could visit. You could also I'm trying to think of the best ways. I mean, you could contact my staff, Kate, her email, staff@Natural Endocrine Solutions. And then also, if you visit, one more thing I'll say, I do like when there's a webinar, I ask people to watch before they become a patient, so they could kind of get a better idea of how I do things. And I have a program where I work with patients. And so if you visit naturalendocrinesolutions.com, and there's a link for the webinars, and you could click on whether you have Hashimoto's or hyperthyroidism, Graves' disease. So that, I would say the thyroid checklist, maybe check that out first, and or my books. But if you're after that, if you're convinced you want to work with me, then go to Natural Endocrine Solutions and watch the webinar, which are pre-recorded, so you could access them right away.
Do you work with patients remotely, or do they need to be, do you need to see them in person?
For the most part, remotely. I do have a physical office, but over the last few years, it's been mostly remote. So no, they definitely don't have to come in. They could, just set up a Zoom or phone, whatever they prefer, phone consults or
Okay.
a Zoom consultation.
Okay, great. Well, Eric, this has been really informative. I really appreciate your time. Do you have any kind of final kind of words of wisdom for people who are either just finding out that they have thyroid health issues and or maybe they've been struggling with it for a while? Any words of wisdom or words of hope about, the process and the journey and kind of what they might be going through?
Yeah, just remember that these conditions, there is a cause for really all chronic health conditions. And it's not always easy to find the cause, not always easy to change one's diet. A lot of it is a mental game, but just about everybody could do it, at least, as far as the diet goes and, the stress management. You just got to do it. You just got to put your mind to it. And just, keep in mind, especially those with hyperthyroidism, but also those with Hashimoto's, is your endocrinologist, really their main goal is to address your symptoms. I mean, it shouldn't be the only goal, but that just comes down to the treatment. I mean, I'm sorry, that just comes down to their training. So whenever you go to a medical doctor, endocrinologist, just keep in mind, as I was mentioning earlier, many times they won't be open to natural treatments. And so their goal is usually just to write the prescription, whether it's for anti-thyroid medication or thyroid hormone replacements. And in order to address the cause of the problem, again, you're probably going to have to work with a natural healthcare practitioner.
Okay, great. Thank you so much. We will put links to all of the ways that people can get in touch with you into our show notes. So we'll have your books, the thyroidchecklist.com, and your website as well. Thank you so much for your time today, Eric, and look forward to seeing you soon.
Thank you. Thank you, Jessica. It was a pleasure. And I hope the listeners and, hope they learned a lot about both hyperthyroidism and Hashimoto's.
I think they most certainly will have. Thank you.